Hi, welcome to this week's With Liberty and Justice for Some. I'm Congressman Mark Pocan. You would think with marriage equality in the United States decided in 2015, the movement for equality would be on a smooth path forward. But the anti-equality movement, largely tied to the extreme religious right, was not taking no for an answer. After all, part of the progress of the LGBT community was the familiarity with a family member, a coworker, a star, or someone they knew, dispelling the outrageous myths that were put forward by the extreme right. But they had plans to reinvigorate their hate. The right pushed an agenda first of anti-trans hate, counting on people not thinking they knew someone who was trans. Women in sports and somehow even drag reading hours became attacks on families, and it was repeated in the most manufactured way. And that led to a reinvigorated debate about religious freedoms. In other words, so-called discrimination against people who discriminate, pride flag bans, and more trash. And with Project 2025 and Donald Trump in charge, more was destined to move us backward. Banning trans people from serving in the military, banning pride symbols in public places, ending suicide prevention services specifically geared towards the LGBTQI plus community, and much more. Well, fortunately, those who care about equality have a federation of groups with a mission to make sure everyone receives equal treatment under the law when it comes to their sexual orientation. And the organization that is the umbrella group for all those local groups, who is it? It's the Equality Federation, and their head, Fran Hutchins, has a long history of not just activism for the LGBTQ community, but leadership at the Equality Federation as well. Having worked there since 2012 and leading the organization since 2021, Hutch has been at the forefront nationally of these fights. I'm with here today with David Sirota, who is the editor-in-chief of The Lever. You may know him as the person who conceived the story and screenplay for Netflix's Don't Look Up, which I think you received a nomination for an Academy Award. Wow.
Yes, that's right.
That's awesome, David. Thanks so much for being with us.
Thank you. Thanks for having me.
So my one question for you today is, if you had the power to change any one federal law, you don't have to worry about Congress or anything else. It's going to happen because you're saying it. What would that one law be and why?
It's a one-page bill, maybe arguably a one-line bill that would lower the Medicare eligibility age to 0.
So Medicare for all.
That's right. I'm being slightly cutesy about it, but I think it could be a relatively short bill that just says the eligibility for Medicare is now age 0. Done. There's your amendment. You got to offer that as an amendment on the House floor.
I like that.
Let's start getting some votes on that, right? Just that's it. And by the way, just to mention, there was a chance that we were going to lower the Medicare age to age 55. I don't know if people remember this. Like, there was a real chance when Obama was president. And they had almost 60 votes in the Senate, and the person who ended up killing that, if everyone remembers, was Joe Lieberman. And Joe Lieberman had only been reelected because he lost that Democratic primary to Ned Lamont in 2006 over the Iraq War, but he ran as an independent. And the sort of Democratic establishment was sort of only tepidly in support of Ned Lamont, and Ned lost the general because Lieberman ran as an independent. I tell that story just to tell you how close we actually got to lowering the Medicare age just to 55, and that there's sort of a domino effect, right? Like one person wins a primary, but then loses the general. The one person is there. They're on the cusp of doing it. And then all of these things matters. There's a real sliding doors effect to politics. So if you're hearing this and you want the Medicare age to go to 0, remember, you don't know, taking out this or that congressperson in this or that district who's an opponent of that. You don't know the ultimate effect that will have, but we have plenty of examples of history where small actions or small political developments down the line create very, very big impacts.
Conversely, the Republican Study Committee, the largest caucus among House Republicans, wants to raise the retirement age to 70.
Oh my God.
I know. Can you imagine? And take away people's ability to get all these help.
Well, it's just horrifying.
I know. Thank you, David. Thanks so much for being with us.
Thank you. Thanks for having me.
It's a pleasure to have Hutch with us today as our guest. Welcome.
Thank you so much. I'm really happy to be here.
Yeah, well, thank you. And let's just start out by explaining what the Equality Federation is and what it does.
Well, Equality Federation, as you said, is a network of all of the state-based LGBTQ groups who are fighting at the state level, at the state and local level, to make folks' lives better in their states. We have 51 state-based partners all across the country in
Great.
42 states. And our job as the convener or the network is to help resource these organizations, build their capacity, help them network with each other and share best practices, and do research, cutting edge research that's going to help shape the way they do their work in the years to come. And so we've been around actually for 28 years, and we were started by these state groups. So it's a little bit different than some other national groups.
Yeah.
We actually are deeply connected into the ground, watching everything that's going to happen and really responding and helping folks along the way with the fight. I know that we were talking about that you were mentioning everything that's happening federally, and it is really devastating. And one of the things that we've been doing since Trump came into office in earlier this year is helping state groups understand what are the impacts of some of the cuts and policies that they've had, and really helping them respond at a state and local level to help the people who are living in their states.
Yeah, and in my home state, I believe Fair, Wisconsin, and is G-Safe also a member?
Yes, Fair Wisconsin
Awesome.
and G-Safe. So right, in some states we have more than one group, which is great.
Awesome. Yeah, yeah. Well, that's terrific. Well, where do we begin, right? The Trump administration has been honestly awful for LGBTQI plus rights in so many ways. Let's start with some of the executive orders because that's something that comes directly from the president, from the White House itself. First, he rescinded any executive orders by President Biden that he
Mhm.
had put in place to move this country forward. What were some of those impacts of getting rid of the previous executive orders?
Yeah, it's not only that he's rescinded some of the orders that the Biden administration did. They've also done, additional executive orders
I'm
that
gonna come to
not only
those.
undo,
Oh, yeah.
yeah, that make it even worse.
Yeah.
And I will say, like, the Biden administration has, was a strong advocate for LGBTQ
Mhm.
folks, particularly transgender folks. They could have gone much further. But one of Biden's first executive orders was actually protecting LGBTQ workers, and
Yeah.
Trump rescinded that almost immediately. And we've also seen executive orders dealing with the definition of gender. We've seen executive orders about uh, gender affirming care or health care for trans youth. And some of the most harmful things that we've seen most recently have to do with the way Medicaid regulations are interpreted. And a lot of this has to do with interpretation and enforcement. And so essentially, what the Trump administration has done is very strongly weaken the enforcement infrastructure for civil rights protections in this country.
Well, let's talk about a few of those. So, he has attacked the trans community in particular,
Mhm.
recognizing only two sexes, and other attacks that he's called gender ideology. He's censored schools on military compounds, and he's banned trans people from serving in the military. Even, what kind of impact, in particular, to the trans community has this all traded by Donald Trump and his administration?
You know, I think that this is not just like what is the impact. It really is a full-on assault on trans people's ability to exist in public life.
To thrive,
Right?
exactly.
It is banning service in the military, as you mentioned, and banning talking about gender diversity in schools and public institutions. Like that is
Yeah.
a deep cut to one of our most, dearly held rights of free speech. And I think that the impact is, first of all, there's the real and tangible impacts on people losing access to healthcare. We can talk about the cuts to HIV funding, but there's also a cultural impact. It really fuels stigma. It encourages these state level attacks, which I'm also happy to talk about. These have
Mhm.
been happening for the last 4 to 5 years, where we've seen a like a big increase in anti-trans legislation. I think it it really isolates trans people. It attempts to isolate trans people from their communities, even from their families, and from the government services that help people live their lives.
Yeah, and some of those very direct, I think, effects have been on gender affirming care, right? We've seen the ripple effects across the country. You've talked a little bit about Medicaid. Maybe you can talk a little more about that. But I mean, I've seen it even, here. We had a friend recently who their son was going through transitioning, and medical facility, I think it was last year, that had a surgery set up, purposely done during the summer so school wouldn't be missed, decided not to provide it anymore. That wasn't even done by Donald Trump. It's been done by a lot of these state hits, but Donald Trump doing this specifically, I think, has had that ripple effect. Can you talk a little bit about that?
The ripple effect is real, and I think that this has to do, and I don't want to get too deep into theories around authoritarianism, but
Mhm.
preemptive compliance is a real problem when we end up with an authoritarian political situation. And what we've seen is some of these threats are, again, like I mentioned, about regulations and enforcement. And some of the hospitals, they're just not willing to take the risk. They've seen the Trump administration go after specific institutions, like different universities and different foundations. And I think hospitals just aren't willing to take the risk that would be involved in a protracted legal battle. And so some hospitals are, in fact, deciding to reduce or limit or even stop the types of care that they're providing, the types of healthcare they're providing for trans people. And it extends beyond youth. You mentioned the Medicaid. It extends beyond. It extends beyond youth to people who access healthcare through Medicaid. Which again, this is one of our social safety nets. And instead of expanding that and making it available to more people to help people in our country be healthier and
Yeah.
do well, they're actually cutting it back for a number of people, not just trans people. But the effect here on trans folks is that they are not able to receive their health care. And it's not just I work primarily at the state level. And so we're tracking all
Mhm.
of this at the state level. And we've seen this happen already in states that have passed bans on gender affirming care. But now we're seeing it in states like California, where there are no bans on care for trans youth. And we're now seeing these hospitals either threaten to shut down, actually shut down, or, as you mentioned, sort of individually, case by case, refuse care for people. Again, to go back to the impact of this, it's obvious that when you don't receive the healthcare that your doctor has suggested that you receive, that's not good for your health. Additionally, I think again it goes back to that cultural effect, that chilling effect, that stigma that is being empowered by the rhetoric of this administration. I just want to say that I'm not an endocrinologist, right? I'm
Mhm.
not someone who's an expert in healthcare for trans people. I would go to my doctor for that. If I had a child who was trans, I would talk to a doctor about that. And instead, we have the government making these decisions. And this is, it's just an encroachment on the bodily autonomy. I mean, we've seen this. This is all over again with reproductive rights, and we've seen them try to take away women's and pregnant people's ability to make decisions about their own bodies. And we're seeing that again now rolling out in this way. And this, it's again, it's not just impacting the one person or the two people who don't get that care. It really is creating this chilling effect across the
Yeah.
country. For providers are actually, I've actually spoken quite recently to a few providers who have had to have personal safety details put on them.
Right.
They've had to have their homes, retrofitted for security. And we've seen, also the unfortunate case of uh, you know, children who have come to testify about their need for this care to legislatures, again, being targeted by the right. And so it's really about spreading fear, it's about spreading uncertainty. And like I said, like most people don't have the expertise to have these conversations. And instead, but instead we're having this conversation in the public square with misinformation and disinformation coming from the right. specifically as a political maneuver from the right.
I think, a strategy we need to do is something that we're trying to do in our office is if any of these groups discriminate, and they decide that they're political organizations and not healthcare organizations, we don't work with them. Right. And so we
Yeah.
were actually working on a bill for a medical entity that we stopped working on because now they're a political organization. I'm not going to work with them if they discriminate. Somehow we'll figure out the right pushback, but right now it's hard when you have an administration
Yeah.
doing this kind of pushing. They've also attacked the Smithsonian and the Kennedy Center when it comes to censoring things about the community. But he also, and I think you talked about it a little in the beginning, he's cutting funding both directly and indirectly for
Mm-hmm.
many programs, both here and abroad, that support equality. Can you talk about a little bit about that funding and what you're seeing the ripple effect again back in states from those cuts?
Yeah, I mean, and you mentioned the attacks on the Smithsonian and the Kennedy Center.
Mhm.
And I think those are just so transparently attempts to rewrite history and culture, right?
Yeah.
It's attempts to erase our stories, to erase our lives from history. And I have news for them. Unfortunately, we are here. We're always going to be here,
Yep.
and that's not going to go away. But it's not just like you said, it's sort of a double-edged sword. You've got the cultural fight, and then you have them coming in and actually creating policies that directly impact folks. And so looking at some of these funding cuts, I mean, I'm personally devastated. I've been really involved in the last 10 years in working to bring HIV advocacy back to the state LGBTQ groups. So there was a bit of a division, once we got some really good federal legislation in the 80s and 90s, late 80s, 90s, early 2000s, creating funding streams for HIV work. LGBTQ groups generally weren't doing as much HIV advocacy anymore. And so we've been really invested at the Federation in bringing that back as an issue and educating our membership about the history of the movement and about the current implications of where we are. I just want to say, like, I was thinking the other day, I'm reading a book right now by Sarah Schulman called Let the Record Show, and it's the story of ACT UP in New York when it was beginning. And I was thinking about all the people she interviewed and the people she wasn't able to interview because they passed away. And it just reminded me that movements outlast lifetimes. And so I want to say I am very concerned about what's happening, but I also just want to say, like, we are at a point now. I read a study from one of the pharmaceutical companies that they are researching and potentially will have a once a year PrEP shot, which would prevent the transmission of HIV, once a year PrEP shot, available in 2027, 2028, perhaps. So we're 3 years off from that incredible change to the way HIV is treated and prevented. And we're not going to get there if we keep cutting these research dollars, these prevention dollars. So I was devastated when I heard about the cuts to USAID, the international AIDS and HIV funding, to PEPFAR,
Exactly.
to the HHS and the NIH grants that fund LGBTQ plus research, specifically on HIV and other issues. These were really devastating to hear about because we are so close to being able to really end this epidemic, and they are showing absolute lack of care for everyone who's living with HIV. And so that's been extremely devastating. We've already seen clinics closing overseas. We've seen people losing their care here in the US. I also want to draw attention to the 998 crisis line cuts and the direct cut to the
Yeah.
LGBTQ services on that. That is unbelievable. I honestly cannot understand why that is. It doesn't save that much money. It wasn't that big of a contract, and it absolutely helped our community. The Trevor Project has been working with 988 from the beginning, and it's just absolutely devastating.
Yeah, we reached out to Secretary Kennedy directly during questioning in my subcommittee in approps. We brought this up, asked if we could try to work together. It was interesting because I think he was so used to, people being a bit more combative because he's got some pretty outrageous positions in some cases. And when I asked it politely, he said, "I wish every Democrat asked questions like you." Well, it's more than just asking the questions. Hopefully he'll.
I wish he would answer it in a different way.
Right. But this one in particular, I mean, given the rate of especially kids who are LGBTQI plus in the
Mm-hmm.
higher levels of suicide, to take that away is really just punitive, right? Like you said, there's not cost savings really. It's
It's
just being
disgraceful.
punitive. Yeah. Yeah, and speaking of disgraceful, Secretary of Defense decided to rename a Navy ship that was named after Harvey Milk. Yes, an LGBTQI plus icon, but also a Navy
An
veteran.
elected official.
Yeah, an elected official and
Yeah.
a Navy veteran. And so again, I keep bringing up all the things and saying, tell me
Yeah.
about it. But really, this is yet another unnecessary level. This wasn't about saving money. This wasn't about waste, fraud, and abuse. This was just about being punitive.
Oh, it's so petty. It's so petty and it's so disgraceful, like you said. Like you said, Harvey Milk was a Navy veteran. He served the country in a number of ways, from being in the Navy, from being an elected official, and really is thought of as a national hero by many LGBTQ and
Yeah.
straight people. Like, he's on a stamp, and erasing him says a lot about their priorities. And it's not national security; it's culture. It's culture war. It's culture war politics. And I just, I go back to this idea that they are fighting from two different sides. They've got their cultural and rhetorical, um, you know, campaign that they have against us, and then they have a really specific policy campaign. And the two things go hand in hand.
Yeah.
And it's not subtle. They are trying to erase us, literally erase us from existence, which is, again, it's a fool's errand, but it produces for them a certain, frame that they can have, that they are, focused on the family, that they are, can't, like, what is the phrase that I think it was actually Pete Hegseth who said it, the Secretary of Defense, who said something about normal gays, or maybe it was the vice president. But they are trying to really erase difference, and it is not just limited to LGBTQ people, right? If we were having this conversation about the immigration situation, if we were having this conversation about women's rights, it really is about trying to paint a picture of what they believe is normal. They've talked now openly about what they believe women should be doing, which is not working outside the home, and which is having more children. And I think we had that debate. Like, I think we had that debate a number of years ago, and I'm just like, how are
Century
we?
ago.
How are we there again?
Yeah. No, and even just what you said around the DEI initiatives. I mean, part of their the other ships that were named also were
Hmm.
named after various civil rights
Exactly.
icons, and they said they're all looking at all of them to
Yeah.
potentially rename. And the attacks are broad, and you bring up a really good point about working together in coalition with all the other groups that are also being attacked, because we all have to have each other's backs. It's really important. What else
That's
are you
right.
watching from for this administration? Other things that I didn't mention, because there are so many, but things that seem to have extra ripple effects with some of the state coalitions that you're working with.
I mean, listen, like, we expect something new and bad every day, right? I think
Yeah.
that this has been the last 6 months of my life, have been waking up and saying, like, what the fresh hell? Like, what is
Yeah.
actually happening today? And they find new and creative ways to try to hurt us. And, I expect them to continue to do that. I expect them to continue to try to make cuts to the way we access healthcare, all of the different programs. I just saw yesterday an interview of someone who was going to go work at HUD, and they were trying to determine if they thought that HUD should be able, that housing should be able to discriminate against gay and trans people. Again, a debate I believe we've already had. And so, I think that it's just going to be one horror after another. And I think that's actually really important for us as a community to understand. Like, they are going to do this relentlessly, and we have to be resilient. We have to actually understand that a lot of what they're doing is rhetorical. Not every single thing they say turns into something that happens. And so we have to be really careful about the news we consume, and make sure that we are getting all of the facts straight, and really understand. And this is hard, because government, as you know, as an elected official, is really complicated, actually. It's not cut and dry.
Mhm.
It's not the bill passed and then this happens. There's so much that goes around it. And so I really hope that the community will not get too invested in every single thing that the Trump administration says about us and says they might do, but instead pays attention to what is actually happening. And the best way to do that is to get connected with your local groups, because
Mhm.
the way that federal policy rolls out, it affects us in our local lives and the lives that we live in our cities and towns. And so really understanding, like for you, and your constituents, which hospitals are cutting care, like really
Yeah.
understanding at that local level where I can get my services, where I can get support, who I can connect with, who's going to know these things. And so even though it's really tempting to get really stuck in the, oh my God, Trump has done something new today that is
Yeah.
horrible, like really actually getting connected with local groups, like you said, Fair Wisconsin, and GSAFE, which is a youth group that serves youth in schools in Wisconsin. Getting connected with those groups is the best way for people to stay informed about what the impacts are going to be on their local community, and also what actions they can take in their local communities to make people's lives better. So, unfortunately, it is my job to read all of these things and to
Yeah.
learn about them and to know how they impact us. I hope for our community that they'll stay informed, but that they'll do so in a way that is really productive and at this local invested level where they can actually take some actions together with people who are also in the same boat.
Yeah, target that angst, that frustration. Because a year ago, I had a conversation with someone who I have a lot of respect for, who works and has a LGBTQI plus publication in Wisconsin, and he mentioned that a number of younger LGBTQI plus folks, particularly I think males, were starting to feel like we had our rights, right? They were coming back, and there wasn't a threat, and they don't know the history. That's why talking about the history of ACT UP, talking about Stonewall, all of those issues, they haven't had to live that, maybe like
Right.
some of us have, or some of us have at least, studied and understand.
Hmm.
And right now we're seeing what happens, right? When you have a bad administration, you have bad elected officials with bad values, these are the ripple effects that happen. I
Hmm.
don't understand how Secretary Bessent can be there as an cabinet secretary. I think I've had some frustration with him for that very reason, because, yes, it's great to have lower taxes if you're rich, I guess. But if you don't have the right to spend it at any bakery or any florist or anywhere else that you want to, because they're allowed to discriminate, what does that mean? Right.
Hmm.
But I love what you just said about people need to focus that energy into those state groups, because
Yep.
Fair Wisconsin's doing great work on the ground politically.
Absolutely.
GSAFE does it in the schools, and across the country, you have similar groups.
We have, yeah, like I said, we've got 52 of these groups working in 42 states. And I live in Minnesota, and we have two groups here as well, Outfront Minnesota and Gender Justice, and they've been doing incredible work. And they work directly with state level elected officials to try to mitigate what's happening at the federal level. And so people can get involved in those fights. I was actually talking to some folks who were working in New York City to help backfill some of the cuts to trans rights through the city budget. These changes are possible. We can't overcome the entire power of the federal government, but we can directly impact the quality of our own lives at our local levels by getting involved. And the groups on the ground, like all of us, especially, like I said, it's my job to have to read this every day.
Mhm.
They're stretched thin. They are absolutely fighting for our lives, and they need all the help they can get. So I really hope that people will get involved, because they're resilient. Again, like I said, we've been around for 28 years. Some of the groups that founded us have been around for longer. We're not going anywhere, but we do need people to pitch in. We do need people to get involved.
And those local, especially local level, but also states, you can be the laboratories for democracy, right? You can still do
Oh,
positive
exactly.
things. Look, the federal government right now, we're not going to see positive things move forward. I'm quite
Correct.
convinced. But we can still have that positive change at the local and state level, working with
That's
those
right.
local state groups. And then when the majorities change, and I do think they're very likely to next year, at least in the House and maybe in the Senate, and if we have a different White House, we'll have these great things to look at around the country that people have passed
Mhm.
that we can then try to implement for full equality.
Absolutely. A really great example is that, I was mentioning HIV policy. And in Maryland last year, they were able to pass an entire suite of upgrades to their HIV policy. Their policies had not been
Wow.
updated since the 80s. And as I mentioned, we've actually had a lot of changes to the way HIV is treated and prevented. And so they were able, through 3 to 4 years of organizing at that state level, to get that law changed. And we can make those changes. We are able to do so, and we are able to still make progress at the state level. And so, and I would say, if not at the state level, if you're in a state where you don't have a supportive and LGBTQ supportive majority, you can often make changes at the local level. We've seen everything from getting people elected to school boards and library boards who are supportive of LGBTQ rights, to actually municipal policies that help LGBTQ people. So I just really do encourage folks not to lose hope in this moment, as hard as it is, and to really pitch in at that local level. And that also has to do, with we mentioned sort of working across movements. It can't just be
Yeah.
LGBTQ, because they're not just attacking us for being LGBTQ. We've got people who are LGBTQ and immigrants. We've got LGBTQ workers. We've got LGBTQ people who need reproductive care. And so we've got to band together, and we are working to band together across issue and across community to fight back.
No, absolutely. And so I'm glad you mentioned, because I did want to end on the more positive side, because there's plenty of negative, obviously. But besides like some of the HIV laws being rewritten, are you seeing other good things happen at the local or state level that
Yeah.
you can share with folks? Because again, I really think this is showing where we can go in the future with positive, movement for equality. So if there are some other stories, I'd love to hear those.
Well, I mean, I want to start out by talking about something that's happening in a number of our states.
Yeah.
So I'm I haven't told you much about myself, and we don't have a lot of
Mhm.
time for that. But I'm an organizer by trade. I'm an executive director now, but I started as an organizer. And my first campaign, really, that I worked on was Prop 8 in California, which was
Mhm.
in 2008. And we lost that campaign. That was a marriage campaign, and it was sort of the last big ballot measure that we lost. And after that, we went out and we started talking to people. We started actually just having conversations, really open and accepting conversations, meeting people where they were, and really understanding why they weren't ready to vote for people like me to get married.
Mhm.
And it was really hard. I'm not going to
Yeah,
lie. I
I'll
had
bet.
tears at the door with a lot of people. At one point, I remember talking to this guy in Maine. He had come out of his house. We sat on his porch for 45 minutes, and I couldn't get him to move. I could not get him to accept the idea that I should be able to get married. But at the
Mhm.
end of the conversation, he said, "Thank you so much for talking to me." And he gave me a hug, and I will never forget that hug.
Yeah.
And we are doing that now in a number of states. We are actually going door to door again and having conversations with folks and saying, "I'm not here to correct your language. I'm not here
Mhm.
to tell you that you are hateful. I'm just here to understand. What do you understand about trans folks, and what do you not understand about trans folks?" And being able to have those conversations, get the conversation out of the comment section, get
Mhm.
the conversation off of the talking heads on cable news, get the conversation off of, podcasts,
Yep.
and actually have the conversation face to face and
Yeah.
directly. We've been able to have some amazing conversations. And this is something that I think gives me hope, because when it comes down to it, I don't think people hate us. I really don't. I think they don't understand us. I think they are scared. And I think that when the Trump administration and the MAGA Republicans try to stoke fear, it's, they've got a lot of tinder, right? So it's like one little spark and the tinder goes up, and they're like, that's the thing I'm scared of. And it turns out that when they talk to us, that's not actually the thing they're scared of. They're scared of a lot of the same things we are: the
Yeah.
uncertainty about finances, the uncertainty about the future for their children, the uncertainty about, their employment and the cost of groceries. And when we're able to have those conversations one on one, we are able to, really break through. And it doesn't mean we change people's minds, but we can create new levels of understanding, which make it harder to scapegoat us as a community. And so that's happening. We're doing it in 4 states right now, but we hope to be expanding and doing it more, and doing it with some of our partners in across the country. And then, some of the other things that have happened, we've actually had some pretty good policy wins in the states this year. So, you didn't hear about these, right? Because of a lot of the stories that we talked about earlier, really took over the news cycle. But this year, I'm just looking at my notes, Florida defeated all of their anti-LGBTQ bills this session.
Oh,
Now
wow.
think back, right?
Yeah.
Think back, right? This was
Yeah.
a really difficult proposition a few years ago, and they made it. Minnesota, where I live, they successfully blocked every single bill and amendment that was aimed at rolling back protections for LGBTQ folks. And that was in a really tight makeup of their chamber. Maine, they killed all 8 anti-trans bills this session. And Colorado passed a House bill that prohibited private insurers from denying or limiting coverage for healthcare for trans youth. So, and there's also the Carlton R. Smith Act in Maryland that I talked about. And even North Dakota passed a really positive HIV law. And a number of states, Washington among them, passed a SHIELD law, which protects healthcare providers. I had mentioned earlier that healthcare providers are really feeling the heat.
Yeah.
And so Washington state passed a bill that actually protects them from prosecution from other states. And so, we are making progress, and it is happening at the local level. And I hope that folks will get involved, because we can really make meaningful changes at the local level, even when things are foreclosed to us at the federal level.
Yeah, no, thanks for offering all of those positive notes to end on. I often mention that when there was some anti-trans legislation trying to stop girls from playing in sports in Utah, it was the Republican governor that vetoed it for some really awesome reasons. And we have good things happening there. And as much as the national news seems to be dark, and sometimes, that benefits some of the cable networks and everyone else to just repeat the darkness, there is light. How do people follow you, Hutch, on social media, your organization and yourself?
Right. Well, my personal social media, for reasons previously mentioned, is pretty locked down right now. But I encourage folks to follow Equality Federation at Equality Fed on most platforms, and also to look for your state group and follow your state group and make sure that you're getting those updates. So you can find your state group at our website, eqfed.org/state groups, or just go to equalityfederation.org and look for our list.
Awesome. Thank you so much, Hutch. I really appreciate you being with us, and
Thank you.
especially for ending so positively. In
It's hard,
preparing,
but we have to do it.
I know you start looking at the totality of what the Trump administration is doing, and it's just like ugly, 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 ugly. But the good news is that's not where the public's at. That's where a
That's
small
right.
subset of the extreme right base for
That's right.
Republicans these days. So thanks so much for being with us, Hutch. Really appreciate it.
Thank you.